So week 2, there's, a lot of things that you need to do. We're starting to get ready for week 3, which is all about exam reviews. Now, I just posted to y'all, so I just got it, the exam reviews, the times. It goes from this Saturday all the way up to, I believe, next Sunday, if I'm not mistaken. I do mine on Saturday. It is quick, it is early, um, earlier than normal. And then we go all the way to let's see, it's Dr. Arstenstall always likes to do Sundays. Or did she do a Monday this time? Let me look. Yeah, she's doing Sunday right before the week. So, you have all different things. Remember, you don't learn from all professors, you learn from some. Find two that you like. I don't say just to listen to mine or listen to someone else's. Always listen to that second, because that second person is going to be giving sometimes explanations that are different. And those explanations are what help you understand. So
Okay, I
we've
have a
done our
question
quizzes.
about that.
Sure. Good.
Okay, so for the review, like, because I'm going to be at work on Saturday, but I want to listen to yours. Can I like listen and not have my video call on? Or do I have to
It's
have, or does my face
listen,
need to be
I
on there?
no, I will just give you your recording. I will give that,
Okay.
almost immediately after.
All
Um,
right.
I'm pretty good with getting them up, especially when I know that I'm leaving early Sunday morning. So I will make sure that, again, that you have my review up, and I'll be looking as we go along, and asking someone to help me, making sure that we get all of the other professors' reviews. Yes. Now,
Okay.
I put it in one announcement. So
Mm-hmm.
it'll say exam reviews. So
Yeah,
you'll
I
see
see
all
that.
of our names, and then you're going to see, it being edited, and then you're going
Hmm.
to have it put in. So this one tells you when they are, tells you the cahoots, has the study guide there. I will make
Okay.
another announcement that says exam recording reviews, okay, or
Hmm.
review recordings, and every single one will be there. And as I get them, I will refresh it. So just go back to that one page. Or would you
Okay.
like 5 different announcements? And I don't think you do. Not with 3 classes. No, because everything is going to go crazy at that point. So I do try to do that to help you keep a little bit more organized, because I know that it is difficult, and it's like you don't want to listen to or read another announcement. I understand. They get on a little bit, a little bit. Exam is week 4. So the week before is when we do the reviews. If you look at your announcements, you're going to see when they're listed. As I said, mine's Saturday. It's like around the corner, 2 days from now, 3 days from now. So that'll be the first one. The review will be there. And as I get them, I'll be putting them in. Okay. So that you'll have all the recordings that you do need um, in order to get through this exam. Now, exam 1 does have, of course, growth and development in it, but it also has your theorists in there. So this week we're going to go over a little bit more in depth about theorists. Some students like to go to YouTube and pull up a video about it. If you don't understand Erickson and Piaget and Goldberg, and Freud, those are the ones you're going to see, and they will have little questions about it. But I try to make it so that you understand it without looking even further than that, okay? So any more questions before I start with today? All right, let's go ahead and let's start with our week 2 PowerPoint. Now, this week is an interesting week. It's all our little kids. This is our infants, our toddlers, and our preschoolers. So infants are ages 0 to 1. Toddlers are ages 1 year to 3 years. And then at 3 years, it turns into preschooler up to the age of 6. Okay. Yes, and Dr. Arstenstall's is the beginning of week. It should be week 4. All right, I'll go back, and that's right. It should be on the 28th. I'll let her know about that. Thank you for seeing that. I don't always see it. Thank you. Okay, let's talk about infants. That's the first subject we're talking about. This is chapter 31. Think about what infants do. They're born 7 pounds. They can't lift their head. They don't even know how to breathe and suck and swallow at this point. And the first thing we do is put a breast or we put a nipple in their mouth in order to eat. And suck, swallowing, and breathing is a big deal because they're obligatory nose breathers. And we got to make sure that nose is open and they can breathe easily, or they're going to get into respiratory distress trying to get that milk into them quick, right? What else happens in that first week, that first year of birth? Well, by 3 months, they're going to lift the head. By 5 months, they're going from their abdomens rolling over to their backs. By 6 months, they're going from their backs over to their belly. And why would we need to know these developmental stages? Well, this is when a child's going to roll off a bed, roll off a changing table, roll off a couch, because now they're rolling, and we can teach that to the parents. Be careful now. By 8 months, they should be sitting unsupported. By 9 months, they should be able to pull themselves up and sort of, take the couch and sort of walk around. Okay. And then by 11 months, now they're putting blocks into things. And by 12 months, they are to the point where they're walking or they're attempting to walk. Now, that's 1 year from not being able to lift a head. They've gone from 7 pounds at birth. At 6 months, they double their birth weight. That's going to be 14 pounds. Now, we look at those things because I've told you nutrition, nutrition, nutrition. And if they're not eating, we're going to see that in their height and weight. Now, their first 6 months of life, they're gaining 1 inch every month. So 6 inches they grow in the first 6 months. Now, that's a lot of nutrition to eat in order to keep up with that growth, right? And then by 1 year, they're going to triple their birth weight. So you can see that, these children are developing really quickly. And the one thing that's the most important is the nutrition so that they can keep up with the central nervous system and the muscles and the growth that's going on. And if they're not getting that nutrition, we're going to see it. Their weight isn't going to be where it should be. And the child cognitively is not going to be as alert as they should be. And we're going to see that. And it is very evident when you have a child not getting fed properly. Now, a baby is born as a neonate. And neonate, that word is considered the first 28 days of life. As a neonate, their heart rate is 140 to 160. Respiratory rate, 40 to 60. So the numbers are really, really high. That's the normals. As they get older, the heart rate and the respiratory rate come down. We know adults 60 to 100 and 12 to 20, right? That's the numbers that we're always given. Now we're going to see them come down. Now, why do you need to know heart rates and respiratory rates? Well, how are you going to evaluate things like pain, dehydration, respiratory distress? You need to know the numbers to see, are they more than or are they less than? And those are the important reasons why. Now, when mommy births the baby, she gives her all of her blood to them and all of their immune system. Now, blood cells do die eventually. They don't live forever. And the baby doesn't really start getting their own production of red blood cells about 5 months, 5, 6 months. So the cells are dying, cells are dying. So sometimes these infants get really anemic. Their hemoglobin hematocrits at birth, 14, 42, big numbers. But at 6 months, it could be 10 and 30. It could be, even lower than that. So understanding that it's because it's normal, because they're not making cells. And we know red blood cells carry iron. So what would we do in a case if the hemoglobin hematocrit went too low? Well, we might give supplemental iron, right? That's one of the reasons why we give iron fortified formula. It's giving them iron, right? It's part of it. And breast milk, we just give breast milk but we give some vitamin D supplements, and that seems to help with the whole process. And then by 6 months, where those hemoglobin hematocrits are getting really low, and they're starting to produce their own red blood cells, well, now we're feeding them. And we start with first food is going to be rice cereal, and it's fortified with iron. And it's the reason why we start with rice cereal. It's the less allergenic of all the foods that we're going to introduce. Now, babies at birth, their heads are big, right? It's one of the things we learned in maternity. Their heads are bigger than their chest. And as they get to be 12, 15 months, they should equal up. Again, it's something we'll look at because here we seeing the head is still big out of the chest. By 18 months, if they're not equal or they had less than, something's wrong. Is it hydrocephalus? Is it a brain tumor? Is it something that's going on? And it would be something that we'd have to go back and look at, right? Babies are born with those two soft spots, as we call them, fontanelles. We have the anterior, that closes about 12 to 18 months, 14, 15 months the normal. And the one in the back is called posterior, and that closes pretty quick, 6 to 8 weeks. And we will be looking at that. The reason is if it's open too long, why? If it closes too quick, that brain can't expand. So these things are something that we look at. Now, babies are born and they don't really see that well. And then when they start to see, they use each eye separately. Now, when you use one eye and the other eye and they don't work together, there's no depth perception. That's what happens. They can't reach and grab it because they can't with the eyes not working. But about 9 months, they start working together. Baby is born, we know they're born with mommy's immune system. And we know that over the first year of life, mom is given the good stuff. Breast milk also is a good way to keep up those maternal antibodies. And then, of course, we're giving all the immunizations. If you looked at the book, there's 2 big pages of immunization. Like, how am I going to remember all of them? Well, they're 2, 4, and 6 months. We give the big ones, and then we give them at 12 months and 15, 18 months are the big ones that we do give. And as this course goes on, we're going to go over really the ones that you need to know. The first one, you learn maternity is hepatitis B. We do give that usually before they leave the hospital as a newborn, okay? Now, babies are born. They're in this nice, wet, warm environment, come out into these cool environments, and they're full of all of this fluid, extracellular, because they're floating in fluid, and they get cold really quick. Now, what does cold do to an infant, especially? Well, I learned the hard way, and I'm going to teach you what I learned. I had given a little baby in NICU a bath. It was in a warmer, not in an isolette yet. And I forgot to turn the warmer on when I was done. And all of a sudden, I looked at the monitor, and the heart rate was the normal one, could be 140, right? It was down about 100. And I went, oh, that's not right. I went up and looked, and I realized it was the warmer was not turned on. So what does cool babies equal? Bradycardia. It does cause the heart, everything to slow way down, just to let you know. Now, ever see an infant born, and then they go to the nursery, they urinate a couple times, they come back, and even their faces look different. They're getting rid of all that extracellular fluid that's in there. And at birth, what do we do for these infants to prevent cold? Well, we take a towel, blanket, warm blankets usually, and we just rub them off and clean up all that extra, fluid, and we put them underneath a warmer that's been sitting there and it's hot, and that will keep them their body temperature good. As they get older, they're not going to need as much of the blankets and the dressing. That little baby down there on the right, every time I see it, I have to chuckle because I know that there are cultures that believe if you have a fever that you need to dress them up warmer, and it's not uncommon. to get an infant with a fever in or under age 1 and they're wrapped up so tightly. And I have to say, oh, let's take a little bit of this off because the fever can't go away, can't get out, and you're making that fever higher. Trying to explain it to some cultures, doing it nicely. Now, there are different movements that we do. We have fine motor movement, which is F fingers, all about hands. What do the hands do? Now, why do I explain this to you? Questions will have fine motor development or they'll have gross motor development. Gross motor is the get up and go, go, go. It's movement, okay? Fine motor is all about how they use their hands and their fingers. So prehension is when they just grasp an object. It starts out with a reflex. You put something in their hand and at their palm, they grasp it. And most mom goes, oh, look, my baby's giving me a hug. I'm never going to tell them it was a reflex because, that's a bonding moment. As they get older, it'll become a voluntary. Usually, mom's giving them a little rattle, something to grab, and they grab a hold of it, and that's a voluntary. About 7 months, they can exchange hands with it. And then they start at this age with sitting in a high chair, because 7, 8 months, they can sit unsupported. So it's right at that time. And then you put like these little food things in front of them to start munching on, those little puff balls or something, and they're going to start grabbing them. Well, they don't do this pincer, which is a thumb and the finger, and very finely do it. It's like the hand goes whoosh in the face and they get it into their mouths. It's called a crude pincer. So by 9 months, crude pincer grasp, moving things side to side, hand to hand, absolutely normal what we look at. At about 11 months, they figure out how to stick their hand into a container and pull out objects, whether it's a toy box, whether it's blocks, whatever it is. And then they should be able to build a block tower of 2 by age 1. Now, could it be 4 blocks for some kids? Absolutely. Could it not be at 12 months, but at 13, 14 months? Absolutely. Remember, all children are different. You have some kids that are walking by 6 months and some that don't walk till 15 months. And they don't walk, they're running by 15 months. And that was all my kids. And that was my grandchild too. Never walked at 12 months. Tried a little bit, but not really. 15 months was running down the hallway. And absolutely normal because he's moving everything in the right direction. And that's a quick quiz for you when you go back and look at it. Now, as I said, gross motor, get up and go, go, go. Well, what's the first thing a child is able to control the movement of? And it's their neck. So by 3 months, they should hold their head up, have good head control. Now, if you look at the upper right picture, that head backwards, it's not coming up with the hands, that's called a head lag. If we see a head lag at 5 or 6 months, they're behind. They should be holding their head up by 3 months. They should also be rolling from their abdomen to their back and their back to their abdomen 5, 6 months. Some do it earlier, absolutely normal. But that consistency is usually that 5 or 6 months. As I said, sitting unsupported at 8 months. And now we can go from laying down on their tummy, get up to the sitting position, and that's about 10 months. And that's very complicated. So fine motor's fingers, gross motor, get up and go, go, go. So the gross motor development, cephalocaudal, that's what we call it. Well, why that word? Well, cephalic means head, right? Caudal means lower, which is feet. So we go from moving the head to walking on the feet. And that's why that word is used there. As I said, they're crawling 6 to 7 months, creeping on the side of the couch, walking on it, standing up 9 months, walking with assistance at 11 months, and attempting to walk alone by 1 year. Now, nutrition. This is something that, again, is extremely important. So, what do we feed a newborn infant up to about 6 months? And that is only breastfeeding or iron fortified formula. And why don't we feed them any other food? Well, their GI system is not mature enough, and they'll just stool it out, and all that extra energy eating, they're getting no nutrition from it. So, breast milk and iron fortified formula. At birth, they're born at 7 pounds. I always use one number as I talk about birth weight. I mean, of course, we know they're all different weights, but they're going to lose about 10% of their body weight within the first week. It's a lot of the extracellular fluid and stuff that comes off too. Now, then they start to gain about a half an ounce a day up to 2 months. Why do you think every visit, whether it's to the pediatric pediatrician's office or urgent care, ER, why do we weigh them? Again, we're seeing, are they getting enough nutrition? Because that's always the number one thing that we're concerned about. We see any delays, it's looking for nutrition. Was the nutrition correct? Now, the things with newborn infants and mothers is especially the breastfed mother. Even if the one who was breastfed ended up in the newborn ICU for a week or so. Well, if they're in the hospital, we're always measuring and looking at how much we're giving these infants. And when a breastfed baby goes home, the mother's not going to be measuring things. And they're like, well, I should be because I don't know if they're getting it. And you want them to have that bonding with that breastfeeding time. If the mother is capable and able to, she should have that opportunity. So, what would we tell that mother? Well, how do we know an infant is eating enough? Well, the first thing is 6 to 8 wet diapers a day. That's telling you they're getting enough in and they're putting it out. And we know breastfed is mostly stool when they're, putting out in their diapers, always very soft and, loose. That's just normal breastfed babies. Also, we're going to see them gaining weight at 2 months, at 4 months, at 6 months when they're coming in for immunizations. We're also seeing that. And as I said, breastfed babies do get vitamin D as supplements. As I said, digestive system doesn't work at birth, not really. You're going to see the stool not formed. It's not going to be like when you're older. It's looser. It could be seedy, all of those things. And the liver. Now think about the liver and what it does. Metabolism, medications, you know, um, this is something we're concerned about with giving medications. That metabolism excretion thing of giving medications is something very closely looked at, especially on your small infants. Now, you get about 6 months, the physician will say, go ahead and start feeding your infant some solid food. Solid food could be fruits, vegetables, cereals. Now, what do you add first? Well, as I said, rice cereal is the least allergenic, least reaction to it. So we're going to be starting with that, and these children need to be on one thing at a time and 4 to 7 days of the one thing. After 4 to 7 days, and there's no allergic response, which could be spit up, could be diarrhea, could be abdominal cramping, could be a rash, could be anaphylaxis, which is the most extreme. But once they don't have a reaction, you can add another food. Now, which is it? Fruits, vegetables? Physicians all have their own what they want you to do. And sometimes it's just the more mothers, what they want to feed their infant next. But we do introduce it. Now, when we are feeding food to the infant, start with the food and then give them milk. If you let them have milk first, their bellies are full. It's just like having a toddler or preschooler eat a snack or a big bottle of juice before they want to sit down to eat. There's no more room because they've had something that filled it up. So first food, then you give the milk, whether it's breast or a bottle. as I said, there sometimes kids do have a lot of food sensitivities, and it be exhibited in many different ways. You know, sometimes you see anaphylaxis, it's easier. Sometimes you see rashes, that's easy. You know, but sometimes it's like this eczema dermatitis skin, and it's not uncommon with infants to see those sort of things. Um, how do we figure out? Well, number one, don't give that food again and see if the rash disappears. And then you will not give that food back to that child till they're older if their body can tolerate it. Okay. If it's to the point of anaphylaxis, that physician at a young age might get them in for some allergy sensitization. So see if is it that food that causes anaphylaxis to go on? And we know if there's going to be anaphylaxis, you're not going to be on those foods. And as they get older, they're going to have their good old EpiPen to go along with them. You know, little Christian at age 1.5 found out he was allergic to peanuts. And it's not that my daughter gave him peanuts. The food that he ate had peanuts cooked in them. And all of a sudden his face blew up. And she called me up. Can you imagine a panicked daughter calling mommy, you know everything, tell me, what do I do? And I had to say, well, get some Benadryl. Well, they didn't have liquid Benadryl. She was at a friend's house. So she made that kid chew on a pill and get it down into him because that was the dose that she needed to give. And he'll never forget it. He still remembers that from that old. Now, sleep. Hopefully, infants go home, they get on a schedule, and they sleep at least 3 to 4 hours at a time with eating. Now, breastfed infants will wake up earlier. Their food is actually a clear liquid. Formula has more, it's thicker, has more, I guess, substance in it per se. So they last longer. But breastfed babies, they're awake more often. They do say walker swings and playpens are not necessarily. And honestly, I used all of them. So again, I think that is a parent choice. But there's Pediatric Academy of Physicians say it's really not necessary. Now, when do little babies get teeth? Well, some don't get teeth till 15 months. And again, that was my kids. They didn't get one, they got 6 or 8 of them altogether. But usually they say the earliest that an infant will have teeth is 6 months. So if they're figuring out how many teeth an infant should have, it's 6 months and then it will be the age. So if the kid is 10 months old, it's 10 minus 6, they should have 4 teeth. If they're 8 months of age, it would be 8 minus 6 is 2 teeth. And that's what they should have. You should be brushing their teeth with only a toothbrush. And as soon as they come in, trying to keep them clean. Another thing is if there's no fluoride in the water, etc., they might consider giving these kids some fluoride when they start with their teeth coming in. Now, dental caries are a big thing in infants. And my firstborn, actually by age 3, had bottle mouth. He had decay in his front teeth. And he's now 40. So, looking about all of the changes that have occurred in pediatrics, you know, sippy cups weren't a thing back then. They had bottles and just different sort of bottles and nipples. They did not have sippy cups. You just gave them a regular cup if you wanted. And I just didn't want juice and whatnot spilled all over the house. So I let him have a bottle. Well, he would take the nipple, put it in his mouth with apple juice, and walk around with it all day long. You know, that was his comfort. You know, how do kids comfort themselves? In their mouth. And that's what he did with the bottle. And before I realized that his teeth were rotting. And that's, part of the dental caries that kids can get. So, how do we prevent them? Well, number one, not letting them walk around the house with a bottle in their mouth, which has sugar on it, which is decaying their teeth. But at nighttime and even at nap time, you don't prop a bottle, no milk, no juice in bed. If they need something, only water. But they prefer actually today is pacifiers. And, I've gone through where nursing said pacifiers are good. Then they say they're bad. Then they say they're good. Well, now there's absolute research that's proven that the usage of pacifier helps decrease pain, stress, during procedures, and it does allow that infant to self-comfort because how do they comfort themselves? Through their mouth, whether a finger, a toy, a pacifier. Now, these are all your immunizations. So, what do we need to know about these? Well, one of the things at birth, we don't give influenza till 6 months old. That's one of the things about it. Varicella is chickenpox, and we give that about 15, 18 months. But remember, that is a live vaccine. So we have to be careful. Are you immunosuppressed? Are you on steroids? That makes you immunosuppressed. It's one of those things. Oh, I forgot. Yeah, they're on steroids. They had croup, and that's why they were on it. Just making sure. Now, colic. Colic is gas, and it is painful. And the kid is a kid is hard to comfort, and their legs are going, and they're just very uncomfortable. Usually it goes away about 3 to 4 months, but this is where parents are exhausted, taking turns trying to hold the baby, like she's holding him in that hold to try to shake him to get, the air out of him. I mean, as nurses, teaching them how to feed, how to burp, sitting them up after they eat. Sometimes, of course, we give those gas X drops or whatever they're called, the Mylicon drops trying to get the gas away, but they usually will outgrow it. But these parents, they're exhausted. I feel bad for them when they're like the kid's 3 months old, and yeah, I haven't slept a night yet in 3 months, and they're working and have other kids, et cetera, et cetera. Some kids sleep a lot, some kids don't sleep enough. And another thing that can occur is called failure to thrive, growth failure. And we would actually figure that out by their weight. So if you have a 6-month-old born at 7 pounds, by 6 months, they should double, be 14 pounds. Well, what if they were only 10 pounds? Well, we could call that a failure to thrive. And it could be parents see that they're spitting up or have gas. They've changed formulas. They've gone off breast milk, gone to formulas, changed formulas. Nothing's working. We know that nutrition is important. So what they'll do is a couple things. They're going to be doing a GI, working up, making sure what's going on. And sometimes they even do EEGs and neuros, making sure that, their brains are working properly. Failure to thrive is very difficult to work with. These kids are very tiny, and we have to figure out how do we get the nutrition to them. Is it metabolic? Is there something physiologic? What's going on that the infant's not getting those nutrition? Diaper rash, one of the hardest things, right? With infants, infant gets a diaper rash, and especially if it's like that bad or even worse, they urinate when they're in nap time or at bedtime during the night. They urinate, stool, and they're crying because it burns and it hurts. So preventing dermatitis would be the best thing. But what would you do? Well, some of the things that have been said is it could be the soap you're using, could be lotions, creams, it could be diapers. You know, Believe it or not, my kids did not like Pampers, could not wear them. You could see the diaper exactly where it hit the child. So it could be diapers too. And again, they look at even what your detergent is that you're using to clean clothes. So all those things need to be investigated. And one of the ways actually to help that clear up is to actually have them with their diapers off, like tummy time, put like a pad underneath them, let them, go where they are. Even at nap time, having that diaper open, get the fresh air on it can help. Positional plagiocephaly. Some children are born and they have to be placed on a side of their head, or they're premature. We don't move them as much. Sometimes they get flat head. We call them toaster head actually, because they're so flat on the sides. Or it could be having them on their back all the time, prevention of SIDS death. And these heads, now they're cephalic, their bones are soft, they're moldable. So it goes flat. But that tummy time is so important for this child because at that time their heads can round out and that flat will disappear. Now, if it's really severe, we can put helmets on our head. And that's what that little kid down there on the lower right is. And that's just to help the head become more round and less flat on one side or on the back. Now, SIDS death, first year of life. It's where a baby dies for no known reason. Some of the risk factors, and the risk factors are important. The ethnicity, and if it's male, I mean, males are more than females, SIDS death. 2 to 4 months is the peak time, and it's if you let them sleep on their tummies. The pediatric hospital that I worked at back in even the 90s was doing a lot of research on SIDS death and looking at follow up when they left the NICU, if anyone had a SIDS death, and then looking at positioning of them. And we know that they've really, really decreased a lot. Cigarette smoking can cause a problem. Overheating, removing some of that clothes when they're too wrapped up. If you're comfortable in a home, the baby's comfortable. They don't need extra clothing on, okay? That's one of the misnomers. They need extra, extra, extra clothing on them. What if they've just had a little respiratory infection? Little mucus in the nose? Didn't I tell you they're obligatory nose breathers? Suck, swallow, breathe. They can't do it, and that can cause SIDS death. Breastfed infants are a very low risk for SIDS death. It's when they're not breastfeeding. They live in a house, no air conditioner, no heat. Those things can cause a problem, air pollution, and then lactonization also can cause SIDS death. And one of the other things, I call it the cohabitation, sleeping with mommy, daddy at night, and they tend to go onto their bellies and they will have SIDS death. I've also had parents. The last one that I saw was a father who was a bigger man, rolled over on his infant in the middle of the night and woke up and the child was dead. So all of those things can cause that. Now, an ALT or an apparent life-threatening event could be a choking event. You cough and you choke and you hold your breath and you turn blue. Kids can do that. That is considered an apparent life-threatening event. It's a moment, a period of time where they're not breathing. They also can call it an aborted or near miss SIDS. And of course, SIDS can be any time of the day or night, right? Usually it's at night because they're there monitored longer periods of time, but ALT can be anytime. Now, if they do have an infant come in with one of these, the kid was breathing, I hit his back, tried to breathe in his mouth, and didn't breathe, and all of a sudden he did, and the kid looks okay right now. Well, the kid will be admitted, and they will be doing again neurological tests, GI tests. Is it reflux that caused those things? Ruling out pathophysiologic type of conditions that caused it. And this child, because they didn't breathe, will be placed on an apnea monitor. And they're easy to use. It's just a little Velcro pad with 2 little electrodes, and it goes over the nipple line. And you set a monitor, and when that alarm goes off, it is ear piercing. It will wake up the child and the parent. Children, one of the big things is safety, injury prevention, making sure that these children are safe. We know, and I've said it before, one of the biggest things with injuries in all age children is motor vehicles, whether they're not strapped in it right, whether they're ran over by cars or by adolescents, playing with cars and they're riding on the outside roofs of cars, doing all the things that adolescents may do. can cause problems. And again, teaching parents about putting the car seats rear facing for the first 2 years of life, making sure that those car seats are not old, that they're up to date, they haven't expired, because car seats do expire. And one of the things we're highly recommending today is all parents learn CPR, infant CPR. So Letitia is a breastfed infant being seen at the clinic for her 6 month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb, which is the following is the best nursing intervention. Sucking her thumb at 6 months, is that bad?
I don't believe so. See?
It's absolutely normal. They suck anything around their mouth, whether it's a rattle, whether it's their finger, whether it's a pacifier, it doesn't matter. As long, as this child is doing everything else right, this kid's self-soothing. She's doing good. So let's look at theorists from infancy to preschooler. One of the most tested theorists that you're going to see on exams, your HESI, and on your NCLEX is Erickson. And Erickson is about psychosocial, how they see the world, okay? Now, an infant, what does an infant want out of life? They just want, if they cry, mommy or somebody comes, gets them, feeds them, changes them, burps them, and rocks them, right? That's all they want. And that's when they learn trust. I cry, somebody gets me, my needs are met. I'm a happy baby. Now, what if they're in a situation where parents don't get that child as quick as they should? Could be, one of those, they're homeless situation, something's going on. It could be drug abuse, alcohol abuse, could be, abuse of mother also. What's going on? They're not picking up the child. Well, this is a child who's going to look distracted, and it's not really going to look you in the eyes, and you can tell a difference. These kids actually have learned not to cry because nobody's coming, and that is called mistrust. So trust, all my needs are met and I'm happy. Mistrust, nobody's coming to get me, and I just shut out the world at that point. Now, Piaget is all about cognitive thinking. How do I think? Well, at birth, infants don't know anything. They don't know that pacifier how to suck, a breast how to suck. They can barely just breathe at this point. Sucking and breathing is a big thing. And then put milk in there to swallow. That is huge to start with. So, the beginning of learning cognitive development is about how they find things in their environment and work with it. Well, it could be mommy puts a rattle next to the infant, and then through voluntary or reflex grasp, they grab it. And then their hand moves, and that rattle makes noise. And they go, ooh, I like that. So next time they get it, they'll rattle it. Well, they might get that rattle in their mouth and go, ooh, I like that. These are all learned responses. This is what I mean by cognitive awareness. This is thinking, how to think, how to work, your situation, your environment. As they get older, they're going to look at you and you're going to look at them and throw them a kiss or stick your tongue out at them. Infants are going to try to imitate you. We know that play is important, that tummy time, things above and noises and those things, all of those, they are learning from it. So at first, in Piaget, we're talking about the touch of things in the mouth and the movement, okay? That's all they know to do with it. As they get older, they say ages 2 to 7, pre-operational. This is when they start with this imagination. They take a broomstick and now they're riding a horse. They put their hands out and now they're an airplane going around, the house, right? These are things they're starting to think and they have fun with it. So they do it. As you get older, thinking and cognitive awareness and acting out towards situations as a school age is concrete operational. Well, what does this mean? Well, concrete is solid. You can touch it, you can feel it, you can smell it, and if you wanted, you could taste it. Something you've seen before, you can reenact. If you saw another kid say something that got him out of trouble, well, you're going to use that same thing to try to get out of trouble because you saw it before. Well, as we get to adolescence, they don't have to see it before. They can think so quick when they want to get something that they want. How about mom says, you just didn't do what I needed you to do. I told you not to do this and you did it. So Friday night, you cannot go to the movies with your friends like you want. Well, what is an adolescent going to do? They're going to make their bed, they're going to help with dishes, take out the garbage, and they're going to get an A on an exam. Formally, they're figuring out, what do I need to do to get out of this? Because I want to go to the movies. So adolescents don't need to see it. They can make it up as it goes. They can wing it as they go. School age have to see it to work with it. Then your toddlers are now just playing with what they have. And cognitive on your infants is learning as simple as a rattle makes a noise and doing it again. Now, body image. We know that children, they'll look at a mirror and they don't know who each other is, right? And they're going to be hitting the mirror and they're probably going to figure out what it is. We know that they start knowing that they have hands and feet and they're going to be sucking on their hands and feet and all that stuff, right? They also know that their mouth gives them calm, gives them pleasure. Another thing is what we call object permanence. What does this mean? Well, you put something next to an infant or a child, and then you hide it. Just because it's hidden, they still know it's there. Get a younger kid and you put your toys away at the end of the night, they know the next day they can go back and find it in the toy box. Infants will find it underneath a blanket or behind a toy. They'll go start trying to wiggle and try to get there. So it's very important that we try to take an object, have them look at it, hide it, let them go searching for it. Now they're working their body to get there. Social development, we know at the first couple of months they just want mommy and daddy or grandma, grandpa, whoever. We know as they get going on to daycare, nurseries, or just babysitters, trying to get them, parents need to go and leave the child there. Now, separation anxiety, also if you're working with a child who's going to be in a hospital. So you get a child who needs to go to a hospital. There are 3 stages of separation anxiety. The first stage is, what does an infant do or a toddler do when you have a mother who's not there and leaves you in the crib and leaves you in a strange place? Well, they're going to be crying, right? Cry, 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 cry. Then, of course, nursing staff is going to try to do what they can do, know hopefully what toys they might like that will calm them. And then finally, the kid stops crying and they regress. They might start sucking their thumb where they haven't done it for a while. They might start, needing diapers when they've been potty trained. Absolutely normal. And then the third stage of separation anxiety is when mom finally comes back. They ignore them because they weren't there. So they just continue to play along. They don't just go running back to mom and dad. Absolutely normal. Stranger fear. They don't like strangers at all. And they don't want to, like, even as nurses, you want to pick them up and put them on a scale and weigh them. They're going to be putting their hands back around and want to go back to, mom or dad, right? Absolutely normal. As they get older, they're going to like peek at you around the corner. And that's part of that stranger fear. We know as they get older, they're going to be talking more, they're going to be able to tell you more. And we know play is the basis of all social. Children from infants like to play, look at toys, at the plays, the whatever. Now, chapter 32, your toddlers. Now, I think it's actually my favorite group of kids. Ages 1 to 3. They're very difficult to work with. They are the terrible twos. They are into everything. And I like this Jerry Seinfeld saying, having a 2-year-old is like having a blender without a lid. Turn it on and they're everywhere. And you can't keep up with them. They're just like that. They are all about me and me exploring the world. And it's me, mine, no, I do. And that's all about what a toddler is. And they're learning and learning. Now, we gained triple birth weight by 1 year. We don't quadruple it till about 2.5 years. So you can see how food and nutrition is less on that list there, right? So we know that their height gets a little bigger. They get their legs get bigger, their chest doesn't grow as much. They're getting more in proportion. Remember, the head is going to be equal to the chest or even smaller then. And by 2, they're half the adult weight height, which is quite amazing. We've talked about some body systems. We know that they're going to be able to hold their urine now. They're going to be able to start to control that and control their bowels. Potty training is going to be starting. We know what toddlers do. Put them in a room, and today many parents need to put their children in daycare for some reason, right? And we know that what do kids do when they're in a room together? They play with toys. And what do they do with toys? They put them in the mouth. So what do they do all day long? Is they swap spit, swapping germs between one child to the next child, right? So frequent upper respiratory ear infections and tonsillitis because they're just always something in the mouth. And those ears, those ear eustachian tubes, they're short, wide, and open. So the mucus from the nose goes right up into the ears, and that's why ear infections there. When we start looking at potty training, we know bowel training comes first. They can feel it better. Then you work on into urine. Gross and motor, they're refining their coordination. They're not as gawky. They're not waddling as they run. It's getting more, like the bigger kid walk. They're using both hands really well, and they are throwing a ball. And you have to be careful. Sometimes it throws it really hard. Their vision is a lot better, 20 to 40. Their eyes are working together, good depth perception. Their nutrition. Now, ever taste baby formula or baby food cereal? It's gross. There's just no taste to it, right? Well, as toddlers, their taste becomes, and then the feeling of that sensation in the mouth, they're starting to understand it. They become the pickiest eaters ever. I call it the toddler anorexia because they don't eat too much. They don't need much at this age. They're not growing as much as they want. They are not going to try new foods if they don't like the way it smells, the way it looks, the appearance. Is it too hard, too soft, too grainy? All of these things. They get into this, they're not going to try. Now, Erickson, on your toddler. Now, Erickson, this is all about psychosocial, right? Think about a toddler as automatically everything is mine. So it's autonomy. They're autonomous, which means they want to do what they want to do and they want to explore where and when they want to explore. And they don't want to be told no. Okay. Now, what is shame and doubt? Well, shame and doubt is when somebody stops them from doing something because they think they're going to hurt themselves. I think one of the things that I remember, with my grandson, and actually it was my husband who had to stop me from telling him no, was let try to jump from the couch over to the other chair and just put a pillow underneath if you think he's going to fall. Give them opportunity. They need to explore, they need to try things, and they, unless they're going to be hurt, of course, don't need anybody to tell them, don't do that, be careful. Wait, let me do it, let me help you. And that even goes with getting them dressed. They want to dress themselves, they want to do everything themselves. So let them. The negativism, again, is no, no, and it's all they know. They don't know yes yet. Everything is a no. And the one thing that we know, if they're going to have to be put in a hospital and they have to stay there for a while, is to keep them on that same schedule, that ritualization. So, what time do they take their bath? What time do they eat? What time do they shower? Having items there that they know is theirs, their pillow, their jammies, their doll, their pacifier they love, or that bottle that they love. Having them there gives them that feeling of comfort. We know at this point a toddler is id, it's all about me, mine. They don't at the end of toddlers they start thinking a little bit about other people, but it's more all about me. The cognitive, I've gone into it and told you about it. Basically, again, it starts with simple things and they can make rattle shake and put it in the mouth. Then it goes from, making toys and magical thinking, a broom into a horse and arms and me on a plane and all of those things. And we know one of the things kids like to do is they love to imitate, especially older kids. So Erickson, toddler. Erickson is all about autonomy, all about myself, and other people telling me not to do it, shame and doubt. So that's autonomy versus shame and doubt. No, no, no. Being ritual and doing routines is what they really need. The cognitive is all about now exploration and figuring how to use things in different ways. Listen to a little toddler talk to themselves as they're playing with their little toys and building things and dolls coming in. There's this magical stuff that goes on. One of the other things that toddlers do in this, what we call that tertiary circular, that very young part of toddlerhood, is mommy has to go into, let's say she has to go into the kitchen for something, and the baby is left there in the high chair and the child don't want to be there alone. Well, they have learned to take a cup or something and throw it on the floor. So they know mommy's going to come back. They know I threw it once or I knocked it off by accident first. Mommy came to put it back on their table. And now they're like, when I want mommy, I know what to do. Again, they're learning how to think. They're starting now to explore their genitals, they're feeling themselves, and it's normal for kids to go through this. They're starting to learn mommy and daddy and playing house. They know who mommy is from other people, and we know that these kids start focusing on things they like. They like, you know, everybody, like a doll, or do they like blocks, or do they like cars, they like racetracks, that these transitional objects, things that make them in an individual. Little Christian had this little doll that was a giraffe, and he called him Mr. Puppy. And you couldn't go anywhere without Mr. Puppy because that's what comforted him. So understanding those traditional transitional objects. As you get into toddlers, we start at age 12 months, one word, mommy, daddy, milk, mine, nana. Very, very simple. By age 2, they start multi-word sentences. Now, it doesn't mean you're always going to understand what they say. So sometimes you have to ask or say, show me. because you just don't understand, and a child will get really frustrated. They understand more than they can speak, so understand that. We know toddlers, they want to be independent, just like I said, me, mine, mine. They want to feed, play, and dress and undress themselves. They just love that. And as they get a little bit more into toddlers, they might see like, mommy don't feel good. And they might come up, and give her a hug and say, oh, better, because that's what we would do, right? Or a boo-boo or something. Well, they start the same thing. Now, there are types of play, and you need to understand what these plays are and know that play is that cognitive awareness, it's building, it's learning how to manipulate things, right? So it's really part of that magical that they get into by preschooler, really taking and using their toys. So parallel play, very important, all toddler. I have a toddler here. I have a toddler here. They're next to each other, but don't you take somebody else's toy. Playing with my own toys, playing with their own toys. They're next to each other playing, but they don't share. Parallel play is all toddlers. As I said, toilet training, this happens whenever the kid's ready. We could say it should be done at this time. It doesn't happen that way. Every kid takes their time. Now, as I said, bowel is before bladder all the time. It happens. Siblings, there'll always be rivalry. You hear the older kids, oh, you love him more than me. He's younger than me, and you love them more than me. It's just part of the normal. I mean, I had 5 brothers older than me that sat on the steps when I was born and cried because I was a girl. Can you imagine? I had these 5 brothers pick on me my whole life. That sibling rivalry, and that was at the max. And my mother didn't tolerate it. And my daddy didn't want his little girl hurt. So, but it's absolutely real. Temper tantrums. What do you do? What do you do when a kid just throws himself on the floor and goes nuts? And I want that. Give it to me. Well, what is said, a child is a temper tantrum. You need to let them have that temper tantrum. Ignore the behavior unless it's behavior that will hurt themselves. And that's what the book says. I think I've seen these most, especially with my younger children, is in the grocery store. When they see a cereal they want or a toy in the box that they wanted and they scream for it, they want it, and they sit on the floor and cry. I'm like, okay, when you're done, I'll be in the next aisle. And of course, they'll come around and be with me shortly thereafter. Again, ignore the behavior. Again, toddlers, me, mine, me, do. They don't help. And we know that toddlers, when they're stressed, they regress. That's how they know to deal with stress, whether it is being placed in a new environment, being admitted to a hospital, they deal with it by regressing, sucking a finger, being incontinent, wanting a bottle, all of those things can happen. It's what they need to comfort. So as I said, nutrition is a physiologic anorexia. So we need to be aware of what little things are they eating. And nutrition, we know that they're going to be eating okay, because we're going to be, again, always monitoring their weight. As long as they're gaining weight, they're doing okay. If they're eating nothing, that would be something that these parents should go to the physician for. But usually they eat a little bit, a little bit of cheese, a little bit of, a vegetable or a fruit, and it's enough. Whole milk does have calcium and vitamin D in it. That's a good thing for them. And we need the fat. We need it for the central nervous system. And the one thing about nutrition you need to remember is, let's say a kid's fallen down and has sores on them, or let's say they had something happen and they're healing from surgery or whatnot. Remember, protein would be important at this case. So I would give protein items to them because it's for good wound healing, right? So adults, children, both of them. Another thing we have to remember is parents' culture, which is complementary or alternative medicine. Sometimes adding these vitamins or things in can be good, and sometimes they're not. And I'll give you an example that I think you can relate to. My husband's Jamaican. When he gets sick, gets a cold, with a little fever, he will make a tea out of garlic and ginger, and he seeps it, and then he pours it through a strainer, and that liquid, put a little lemon and honey in it, and he will sip on it, or he'll eat it hot. Or, if it's for my grandson, he will give it to him cold. Now, what if there was a problem with bleeding coagulopathy on these children? I mean, cardiac children, sometimes they're on things like Coumadin. Remember, G prolongs bleeding, right? We learned that pharmacology. Garlic, ginger, both of them could have problems. So remember these things as we're taking down this information. And we know kids sleep all different and nap differently. Dental health, they should go to the dentist when they cut their teeth. Again, it is making sure that they brush. From ages 1 upwards, they should be in grade 1. So they'll be 6 years old. They should be able to floss their teeth before their bedtime. Again, that helps with their dental health. Think about what school age children do at that age, 6, 7, 8. They're losing teeth like crazy. We've got to keep those teeth as clean because the new ones are coming in. And again, fluoride there, if we don't have it, it should be introduced. Children put everything in their mouth, you got to be careful with. Lead poisoning. A lot of times lead poisoning is in older buildings. What do kids do? There's a window and there's a windowsill and they go up to it and they're teething, they're chewing on the paint. That's how they could get a lead poisoning in an older building. It's not as much anymore, but we do mention it. And the treatment would be chelation therapy, where there's medications that we could give, which attaches to the lead and it will just excrete it through the urine. Or sometimes there's something called apheresis. It's like a dialysis to remove substances. So it would be done. Kids not acting right is something actually we'll be looking at. When we have a kid who is ingesting something they shouldn't, remember today we do not say that any kid should be induced to vomiting. Remember we used to give Epicac years ago, make you vomit? No more. And the reason is because it could burn the throat or they could aspirate it to go into their lungs. And we don't want further damage. What we as nurses should be telling our parents is to have poison control numbers posted or programmed in their phones, right? So they can get a hold of them quickly. I did a lot of triage in the emergency room the last 10 years I'm in the hospital. And the first thing I do is get vitals, weight, get the history. I call poison control. Tell me what's the most up-to-date way to treat this. And they actually call back to make sure the kid was okay. Now, what is the most thing that kids would come in that they have gotten into? And it's actually their vitamins. They love the Flintstone chewable vitamins. And as long as it doesn't have iron in it, we're okay. Now, I've seen them with rat poison, those Tod Pods, those little kids would bite into them. I mean, I've seen all crazy things. And again, treatment for it all depends on what they have ingested. Safety promotion, we've talked about motor vehicles. Again, drowning young kids, making sure pools are safe. Little Christian, he was swimming by age 2, but he will not go into the pool without asking first. He did it once and I'll never do it again. We scared him really hard. Again, protecting from falls, aspirations, all of those things. Now, car seats. Car seats, the funny thing is looking at this picture, that top left picture, it looks like my mother and me sitting in the car seat. We had that car seat and we were in the front seat. I remember clearly the 2 youngest kids would sit between my mother and my father in the front seat. Remember, the cars were huge back then. I mean, I'm talking in the 50s. So while ago, guys. Anyway, car seats are important. We use them, and making sure that we have the straps snug. We can put little baby blankets underneath to hold them in and make sure they're not expired. That's the big thing. Gross motor, we've gone over those things. You can look at them again. And a preschooler. Now, preschooler, ages 3 to 5, 3 to 6, depending on what book you're going to read. We know preschoolers now, we're going to be sending them to school. Like if formalized, sit down, have to pay attention to school. And we need to get those kids ready and how to teach parents. School's important. They need to learn in order to get anywhere in life, right? One of the ways is reading to them every day. Books are important. Let them read to you, them read to you, whatever works. We know that it's the attention span is a big thing, but teaching them that is important. And, again, now you have another person working with your child, inflicting their preferences to them. Again, now we're getting more people involved in your child. You still are on slow growth. You're still on slow weight gain. The body's getting more and more, stabilized and mature. And preschoolers can actually deal with stress a lot more. Toddlers don't. Preschoolers can more, as long as they know what's going on. Gross motor, get up and go, go, go. Walking, running, jumping, climbing. They're doing all of those things. Fine motors, they're starting to learn to write their names, their alphabets, to color, make circles, buttoning their shirts up, right? All of these things. Now, Erickson, okay? Psychosocial. So this is something where preschoolers like to do the right thing and they like to help. And if they can't, they're going to be feeling a sense of, gee, what did I do wrong here, right? So it's a sense of initiative. What can I do to help mom? The other thing we're doing, and we're going to talk to that about Kohlberg again, they're learning that right and wrong as part of psychosocial. Cognitive development, they're learning how to sit, how to listen, how to absorb information, and to, talk to the teacher about what they've learned. We are getting socialization, other kids, other type of personalities, learning it. All really important. They're really ready for school at this point. We know Piaget, cognitive development, their language is getting so much better. They're going to be using words. Teleportation was a big word when Christian was 4 and 5 years old. Everything teleported everywhere. I'm like, okay, whatever you say. But it's part of that language and building and experimenting. They don't understand time. In time, what do they understand? Talking about understanding time is not when we say about 4 o'clock in the afternoon, your mommy's coming to get you. No. When you wake up from your nap, mommy's coming to get you. Time is based on an event. When morning time comes, which means the sunshine tomorrow, we're going to get in a car after we eat and go to Disney. This is the time that they do know, okay? And they're starting to understand that casuality, which means doing right, doing wrong, good stuff gets me good things and bad stuff gets me yelled at and punished. They're starting to understand that a lot more now. And then this is that magical thinking. As I said, preschoolers, put them down, playing with toys, just sit there and listen to them. And I think it's just so precious. Now, the right and wrong thing, okay? They're starting to learn it, but what does Kohlberg say? Well, Kohlberg is all about morality, which is right and wrong. Now, they also believe in reward and punishment. They believe they do good, they get a reward. They do bad, they're going to be punished. So, right and wrong, and there's a consequence for each. Body image, they're starting to understand more about differences. They're seeing white skin, dark skin, green skin, freckles, curly hair, straight hair, fat, skinny, tall. They're starting to see all of those differences now where they didn't before. Another thing, this is the age of band-aids. They feel if they got, as a Christian would say, oh, but I got blood there when he fell down, getting abrasion and it's bleeding. Feels if a band-aid doesn't go on and cover it, all of his insides are going to come out. He's going to bleed to death. This is what they believe. Really crazy, isn't it? They're also afraid of anything, that touches them, that intrusive experience. Could be blood pressures, could be getting blood drawn, all of those things. They're getting really scared with this stuff. Spirituality is what they know from home. Hopefully, they pick up a little bit from school too. So now you've got multi-spirituality going on there. One of the things that they believe in is if they do, because they're right and wrong, they're believing this stuff now, right? They are realizing that if they do something wrong, they're going to be punished. So I fell down and my arm broke today because yesterday I bit my sister. I hit my sister. So I'm being punished. God punished me. And this is what they believe. Sexuality, girls like daddies and boys like mommies is just part of it. They're becoming more modest. They are into sexual exploration. They're into touching themselves in their private places. Masturbation, absolutely normal at this age. They don't need to be doing it in the living room in front of, the family or company. That's when you'd say, I just go to your room. But you shouldn't make a big thing about it because they don't realize they're doing wrong yet, okay? And then, of course, they want to know, where do babies come from? Don't explain it until you ask them, so where do you think it come from? I don't think they want to know all about the act that mommy and daddy have to do to make a baby. So it might just be saying, well, daddy has a part and mommy has a part, and they come together and there's the baby. Could be a kiss. All right. Social development, they are not bad with separation anymore. They know that mommy's going to be coming back. Of course, mommy and daddy do have to guide them, keep them safe, always, always. And as I've said, throughout this is those objects that are comfortable, that blanket, that doll, that pillow, whatever it is, they need those things. It gives them comfort and it will keep them stresses down. And play therapy. Dramatic play therapy is when we try to figure out what happened that caused them to fear. And then just play therapy is like, what are you afraid of? It could be a needle sticking them. So it would be giving them a doll, let him play with it. Tell me what you're afraid of and giving that time to do it. So play therapy is very important. As I said, language getting more and more, is getting more complex. They can, tell you what they want a lot easier. Their social behavior, they don't need the schedule as much, and they're not no, me, mine, mine anymore. So schoolers are now associative play because they can share in groups, right? They can dress themselves. Might be inside out, might be the buttons button wrong, but they will be dressing themselves and undressing themselves. And again, they want to please, they want to do good. And they will, at times, for instance, bedtime is always the big thing. Why can't I go to bed when my brother goes to bed, my older brother? Well, because you're younger. And they're going to challenge little things like that because, of course, bedtime, no young kid wants to go to bed now. As I said, associative play is what they do, 2 or more children together playing, but there's no goal, which means they're just playing with toys, but nobody said, let's make a racetrack or playing a board game. Somebody wins. It's not like that. They all play together. Of course, imaginative, imitative, all of those things. And then, as I said, the dramatic play to find out what happened, with fear. So fears, all of a sudden they're afraid of the dark and ghosts and monsters are there. And I don't know where that came from. I know that my Christian went through it, and we would tell him, well, when you see the ghost, could you come get me so I could say hello, find out who he is, make sure whatever. And he would look at us like, what? So it didn't make it as fearful. Being alone, walk outside for a second, get in the house, you're going to hear them screaming, where are you, mommy, daddy? And they cry if you're out there too long. They're afraid that their body parts, like their penis, their testicles, be cut off. Castration, why? It's just part of them. And then they're afraid of objects or people associated with pain. That's you and me, because we're always given shots, right? And that's about what I've also said about here. Sexual education, I said, know what they know, find it out, and you should use correct anatomic words. My little Christian did live with me in the very beginning. So I asked mom, I didn't just say what I wanted, but I said, you should use the proper words. What do you want to do? And she goes, all right, vagina and penis. So that's the words he knows. And as I said, masturbation is important, but it should be that private act, not in front of people. Speech therapy is part of that, late toddler into preschoolers. And again, speech therapy as soon as we can institute it. And we know the earlier they get into it, the quicker they will catch up. And children are resilient, they catch up quickly. So sleep problems. You have kids who sleep all night, no problem. You do have some. My second oldest grandson had night terrors. He would wake up, but he wasn't awake. And he'd be screaming and he'd be punching and he'd even get out of bed. And they called them night terrors. And they became to the point where they had to give him something to help him calm down. So they just gave him this melatonin, which worked actually really, really well. Another thing with the preschoolers is that consistent bedtime ritual. And it's usually, don't have them outside running around the yard, come in, wash your face, brush your teeth, go to bed. You have to have them calm, do calming things before, watch a movie with them, read a book before they go to bed. Consistent routines, that slow down time. Injury prevention, using all the proper equipment, using helmets, knee pads, elbow pads, wrist pads, if they're going to be doing certain different things. It helps with those injuries. And we know motor vehicles is always that number one, all children. So children, when they're younger, need a lot of protection because they don't know better. They haven't seen it. You have to protect them in a way. As they get older, now they need the education, the why. Why are you protecting me? What can happen? So they understand. So cognitively, they're getting more and more, better in understanding sort of things. They're going to ask questions all the time. But why? But why? We have to answer them, okay? And now they're starting to want their friends. They want to go to their buddy's house after school, or they like to be in school and aftercare with their buddies in there, right? And we know at age 5, they're going to enter into real school, and that school is longer than preschoolers. Communicable diseases. Communicable diseases, yes, we have plenty immunizations, upper respiratories, flu, those things. Yes, we can help decrease incidences of illnesses. We can't get rid of all of them. So how, as a nurse, you have a child coming in with, let's say, an upper respiratory. What do you need to know? Well, the assessment. What's the kid look like? Are they in respiratory distress? Or do they just need nose suctioning, right? Were they around another kid they knew were sick? Do you know a child who now has chicken pox? Are they going to break out with chicken pox? Chicken pox is something, even with the vaccine, they can get it. And it is dangerous for you as a nurse and other children. in a doctor's office or in an ER. So they need to be put in a private room with what we call a reverse airflow. So the air from the room goes outside and not into the hospital environment because it can spread chickenpox really, really easy. So upper respiratory, you've done those things, and finding out, do they have an immunization for it? Well, an upper respiratory could be pertussis. So if they don't have an immunization, again, that's going to alert you to be careful about you, your health, and other children, right? So preventing the spread, and of course, as nurses, we're always washing our hands, using gloves, etc. Conjunctivitis is a big illness that children have. Again, they're out, they're playing with each other, they're swapping their germs. Even when they get into preschool and into kindergarten, absolutely, they're still doing it. How would you clean these eyes? Well, warm water inside out and one at a time. And then you put in the medications. Be careful if this medication is an ointment. Let the kid know his vision's going to go blurry. That blurry vision will go over those eyes and they'll get really scared. Something that you should tell them. And those warm, moist compresses can help if that stuff is caked up, especially in the morning. And one thing, and it's nowhere in no book, but one thing I teach all parents that have children with conjunctivitis, I tell them every time a kid lays down to take a nap or sleep at night, change the pillowcase because they're going to go back into that pillowcase again. It's not in a book. I'm just telling you if you ever want to work pediatrics, if you have children. When they have stomatitis, that mouth and cold sores, they hurt. Know that they do, and there's different ointments that we can put on there to help with it. Worms, we have the pinworms, we have roundworms. This is the kid who likes to be outside in the dirt and the fingernails are too long. And we would know that they had worms when they have intense itching anal area. And usually at night they like to come out in the dark. So how would you figure out, do they really do have worms? Well, what they say is at night, go in the child's room, have a piece of Scotch tape, open up the buttocks and just put it on the anus. And you'll see tiny, itsy bitsy, like a half a grain of rice. They're tiny, itsy bitsy things. And then if one child has it, they're probably going to treat the whole family because they go around to all of them. Prevention, keeping their fingernails short. Okay. And again, washing hands. Now, child neglect, something I wish I've never seen. I've seen physical neglect, I've seen emotional neglect, and it's something that will stay with you. Now, it's very difficult to be a professional nurse, having a child come in that has been abused, and you just want to take a baseball bat and put it over a parent's head that brings them in, right? Because you're like, how could you do that to a child? Well, you're a professional. Don't do that. Because it's not necessarily the person who brought that child in. It could be somebody else, okay? I've seen children come in with fractured skulls, and then on further explanation, they had fractured humeruses, fractured ribs, fractured femurs, and they're 3 months old. And it ended up one twin, we brought the other twin in, and the 2-year-old, all the family, we found out they were abused. And what is our job as a nurse? To protect the child. So who do we tell? We tell the charge physician our suspicion, and we tell the charge nurse. Usually they'll call in the police, DCF, if we have substantial information to prove those things, okay? And I know it's hard, but again, your job, focus on the child. Keep the kid safe. Physical abuse, sometimes we have something called mush housing by proxy. This is when a parent keeps a kid sick. I've seen all different explanations of it. This is a kid who's always in the hospital, always sick. This is a kid who's always with vomiting, diarrhea, or a wound that doesn't heal. This mother could take medicines and put it in stool or urine and dirt and get those wounds dirty. And they just like their kid being sick. So how are you going to take care of a suspected parent of Munchausen syndrome? Well, your job is to protect the kid, right? So if the mother comes in and that's the one we suspect, somebody should be with them. Don't ever leave the parent alone with the child. And if they're bringing in food to feed the child, it needs to be inspected because they could bring in food that had stuff in it which could make their child ill. Okay? That's Munchausen by proxy. When we have children with child abuse, it's not only figuring it out, giving them treatment, it's making sure the child and the family have support for discharge and that they are protected from further abuse. Now, that twin with the other twin with the 2-year-old that all had multiple stages of injury, it was the father. The father is now in jail. The mother was working so hard because the father lost his job. And she was working 3, 4 jobs to, make sure they had a house and food, right? And so that's the person who brought the child in. It wasn't her, it was the father. So the father finally admitted to it, and those kids were kept safe. So you have parents tell the nurse that their 3-year-old daughter and a male cousin at the same age has been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? Well, 3-year-old preschooler, is it normal that they're inspecting each other? Isn't this part of learning you're different from me? You have a vagina, I have a penis type thing. What should you do?
Could be
Well,
B, like you don't want to condone it, but you don't want to like shame them.
absolutely, absolutely. The one worst thing we could do is make them feel like they've done something wrong. It's their body. Say, okay, yes, he has a penis, whatever. Come on, let's go have some ice cream, or let's go watch a movie. Just switch the attention, and they do well there. Well, I really don't have time for a Cahoots tonight. It's 60 some odd, so I can send that to you, which means you get out a little bit early, 5 minutes early tonight. Is there anything that anybody needs me to do? Anything you want from me next couple minutes? Or you're very grateful to go get some downtime? I saw the smiles. I don't blame you. Again, I'm on vacation next week. Professor Pace Chismar will have your class. I will be sending you her link that you can go there. If you have issues during the week, Professor Morris or Professor Chismar, you can ask them questions. They're both, I've trained Professor Pace Chismar, and actually Professor Morris and I have the same birthday, 6 hours apart, same year. We are like twins. So she understands me and I understand her. So whatever you need, and if you have to go to Dean Brown, trust me, I do not mind. You need something, I can't give it to you. Please get whatever your needs are, okay?
Is it the same time next week with Shizmar?
Same time, same
Okay.
thing, just a different Zoom.
Well, thank you and enjoy your vacation.
Oh, thank you so much. I need it so much. And it's with my
Thank you.
daughter, my grandson, and her husband, and we all get along really well. So it's going to be fun. I might go zip lining. You never know.
Ooh, go wild.
I don't know, but you might. I'll let you know. Take care, guys. Been a
Good night,
pleasure.
Thank
Dad.
you.